I get the flu shot every year, so why wouldn't I get a vaccine if there is one?
I don't know if it's going to cause any complications later.
Ask people if they'll be first in line to get a COVID-19 vaccine.
I want to know what would be in the vaccine.
And responses are all over the map.
I guess it's just, you don't want to be the first, you know.
A new Angus Reid survey found half of Canadians say they'll get a COVID-19 vaccination as soon as it's available. But around a third of respondents want to wait a while. 14% say they don't want to get vaccinated at all.
People need to widely accept it. And we know from other vaccines that there's a lot of discontent and fear.
In this case, fear may stem from just how quickly COVID vaccine candidates are being developed and tested. The survey found among those hesitant about getting a vaccine, 3/4 are worried about possible side effects.
All of the clinical trials have data safety and monitoring boards which review all of the data to ensure that the vaccines are safe.
Canadian vaccine experts stress all vaccines are rigorously tested on thousands of people.
Those are big numbers and should allow us to get a really good handle on safety considerations for really large portions of the population.
But it may not be enough to reassure all Canadians. At least 70% of people will likely need to be immune to this virus to curb infections. So if a chunk of the population doesn't get vaccinated, it could leave those most vulnerable to infection even more at risk.
Elderly people, are notoriously hard to vaccinate because their immune system becomes what we call senescent. It just doesn't react as strongly as it did when they were at younger ages.
Experts say it's up to everyone else to get a vaccine if we want to have widespread immunity. Lauren Pelly, CBC News, Toronto.